The last question for you today is, how do you see this changing our approach to treating genetic disease in the future?
I think in many ways our fundamental approach won't change. And what I mean by that is we have for some time through newborn screening programs for conditions like PKU, hypothyroidism, enteric aciduria, maple syrup urine disease, we've understood for quite some time the power of fusing newborn screening, the ability to detect a problem at an early stage, with the idea of preventative therapies. So in the case of PKU, a special diet. In the case of MSUD, a special diet. Gene therapy is really an extension of the same idea, but with a much more powerful intervention. The way this is going to change our practice, I think, is it's going to greatly expand our concept of what we should be screening for. And what we should be screening for will be driven in large part by the technological advances that allow us new opportunities to treat diseases that were previously untreatable. And SMA, spinal muscular atrophy, is an excellent example of that. Prior to the advent of gene therapy for that disease, a child was likely to be dead or on a ventilator by age 10 months with the most severe form of SMA. Now, with the advent of gene therapy, not only can those children expect to live well beyond 10 months, but some of them are walking and making normal motor progress after having received gene therapy. This has prompted newborn screening throughout the United States and has shown us that the only way to fully leverage the gene therapy technology is to detect children early and apply the therapy at a very early age. I think this is going to really broaden the horizon of what we should be screening for in the populations. I think the other thing to say about how it will change our practice is we'll have to be creative working with scientists, industry partners, in making sure that as these new therapies become available, that they are accessible to our patients. As you know, many of our patients don't have health insurance, and for those who do, those health insurance companies may not pay for these new gene therapies, which are very expensive. And so we want to work closely with industry partners, academic partners, so that as these therapies become available, we can make sure that our patients can get them.
Thank you. Thank you, Dr. Strauss, for your time and for sharing your knowledge with us.
It was a pleasure. Thanks for speaking with me today.
Thank you for joining us and listening to Dr. Strauss.